What is up, everybody? How are you? We are already in May, so we are answering another question of the month. So this question is, I had to think a little bit, right? This question is multi-dimensional, multi-layered. So the question is, now that AI and ChatGPT can be used to create a fake my chart, what advice would you give someone living with HIV to protect themselves? Now, I think before we get into protecting ourselves, I think it's important to talk about AI and how artificial intelligence is changing the way we work, the way we research, the way we interact with each other, and the way we get our news. And AI is, of course, full of misinformation, and it's really easy to use AI to mimic people's faces, change and edit things, and there's a lot of room to confuse and potentially harm people. We were just recently, this topic came up where I guess somewhere someone was using using AI to edit their my chart. Which, displaying their STI status, really anything, any results, but specifically STI results, and, covering them up and showing negative results in a way to, prove to others that they're negative, or, that they're clean, or, using it as a way to deceive people. And I think the bigger issue is that it's deceiving yourself. People lie to people all the time, and this isn't to say that people who are positive are lying about their status and editing their my chart. But if there is anybody who is doing that, when it comes to HIV and their status, we can blame stigma, and we say that word a lot. But if someone isn't confident in sharing their results, or they're actively engaging in sexual intercourse or drug use with someone without disclosing their status, and they could be detectable and transmit the virus, it's not only selfish to the person, it's selfish to the people around you. And this goes for all STIs as well, not even HIV. I think, a lot of STIs don't even have a symptom, so it's pretty easy to say, look, there's nothing wrong with me, and these are my results, and they're negative. It's a hard discussion to have with someone you're about to be intimate with, to talk about STIs, to talk about HIV, and, whether you're tested or not. And unless you're going to the person's doctor and speaking to them, you're never really going to know, right? Like, they can make a fake result, they can get a fake signature from a doctor, it can be a screen grab from someone else's results. So any way that you're deceiving anybody, no matter your status, I think is incredibly selfish, and it harms not only the people around you, but it harms yourself. You're lying about your health, and you're lying to yourself about how to take care of yourself and how to respect yourself. If you're gonna put someone else's life at risk because you're afraid of, what someone might think, or that you might get, rejected, that's not a good reason. The people who reject people living with HIV and, aren't ready to have that conversation, or, aren't on PrEP, or, are misinformed, you don't want those people in your life anyway, right? And we're not, just because we're positive, us as advocates, we're always out to educate, but people who are positive, it's not their job to educate people. So at the end of the day, people lie, and you have to take care of your own health. Make sure you're on PrEP, make sure you're on doxypep and getting tested. And in the event that you're with someone who lies about their STI status, their HIV status, hepatitis, herpes, literally anything, don't lie. And take care of yourself. In the world of AI, it's hard to know what to believe, but believe in yourself and take care of yourself, because at the end of the day, you can only believe your own truth, and the only person you can trust is yourself. All right. Thank you guys. Thanks for listening, and be careful out there on the internet.